Good morning, everybody. Thanks for your patience with all the technical craziness. I'm not really sure what's happening, but apparently I can't live stream. Um, going to talk a little bit this morning about developmental delays. And the reason I want to talk about this is because it's been kind of coming up for me a lot lately. I want to make sure that we all understand what it means when I say developmental delay, what it means for your child, and then how do we figure out if you have one, and what do we do about it? So, developmental delay literally means that there's a time lag between when other children are learning to do a skill and when your child is learning to do a skill. So your child learns it, it's just they're kind of behind on the timeline, doing it at an older age than what most kids require to get to learn a new skill or concept. That's it. That's all it means. The problem with a developmental delay is that for some children, they don't make up that gap. No matter what they do on their own, they don't know how to learn that skill. And unless we help them, they're going to stay forever behind. The other thing is that sometimes developmental delays are a marker for other things. So if I see a delay in one area, I start looking for medical problems in another area. And that's mostly why we evaluate children for delays. So how do we know what normal is? Well, somebody infinitely more patient than me has studied millions and millions of children and run developmental tests on them over and over to try to pin down the ages when kids tend to pick up certain skills. From those millions of kids, we've created screening tests that we use in the office to try to categorize your child a little bit into developing normally or not developing normally. So that's always a little hard because we're comparing to other children, but it really is the best tool that we have at this point to make that kind of assessment. So if you walk into my office for a well child visit, what's going to happen is I'm going to hand you a 6-page packet of paperwork, and yeah, it really is like 6 pages. Going to ask you a bunch of questions about what your kid can do, and you're going to circle, yes, they can do it, no, they can't, or sometimes, meaning like they've done it twice but not reliably. And from there, I review it, calculate a score for your child, compare it to other kids your child's age, and then we talk about whether or not that's on target or not. But one of the questions is, how do you know if your child's delayed without me intervening and actually having to do a screening test? And there's a couple of things that are worth thinking about. And one of them is one thing I usually discourage you from doing, actually, and that is comparing your child to other children. The truth is, though, that most kids do stuff at a given age. And so if your child is not doing things that other children their age are doing, if your little one isn't doing what your older ones did at that same age, you might have a problem. And really the best way to sort that out is to talk to somebody like your doctor who sees kids over and over and over again. And then we can kind of work out, is this really a thing or is it really not that big of a deal? The second way that you might know that your child is struggling is, are they doing things but maybe not the way that other kids do them? Are they talking like other kids? Do they sound the same as other kids? Are they using all the same letters as other children their age? Are your children playing with toys, but are they doing it in a way that's kind of weird? There's not a good word, but it's the perfect word at the same time. Little kids play with cars and they drive them over furniture and over people, and that's what you do with cars. Is your child just spinning the wheels with his finger? That's kind of a marker for me that there's something else going on. So not doing stuff on time or doing stuff that isn't quite the way other children do it are two things worth looking at. But there's two other groups of kids that sometimes get left out. One of them is medically fragile kids, medically complicated kids, kids with medical stuff going on in general. Our former premature infants, children with heart problems, children with lung problems, any kid for whom much of their childhood is spent in a hospital or in a doctor's office or getting treatment for something medical. Those kids tend to fall behind. And sometimes we'll even refer them proactively rather than wait until there's a problem. And then the last group of kids that I personally think gets left out a lot, and I want to make sure that we talk about, are the children with, quote unquote, behavioral problems. if you are pre-kindergarten, so basically 5 or under, and someone's saying that you have a behavioral problem, you probably have a developmental problem. You may also have a behavioral problem. There are real psychiatric illnesses in small children, but most of those are accompanied by developmental changes. And sometimes when we address the development piece, we also manage to address the behavior. So if your child's super aggressive, if your child is a wild man, as I call my little one, the wild man, but just everywhere, all the time, running into furniture, climbing on things, crazy child. If your child is bothered by lights, loud noises, strong smells, in a way that doesn't seem normal to you, those behaviors may actually indicate that there's something developmentally happening. And then from there, we can kind of go down that pathway. So let's say that you've looked at your little one and you think, gosh, that's not right. I need to talk to somebody about this. What do you do? How do you get help? How do you try to get that child back on track? The goal here is to take your child who is delayed and close the gap between them and the other children their age. Bring them back close to, if not at, the normal developmental status of a child their age. That's all we want to do. In order to do that, you need more than your pediatrician. I can identify it, but treating it is really time consuming, and frankly, your doctor's not really trained to do that necessarily. What should happen is if you identify a developmental delay at home, or if I identify one in my office, what I'm going to do is refer you out to an agency that does these assessments. And there's basically 3 kinds of agencies that can help with this issue. There are private physical therapy offices, occupational therapy offices, speech therapy offices that contract through insurance companies to provide care to children. And we have actually a number of those in the city that are very good. The other option for kids who've already turned 3 is actually your school district. So the government requires public schools to provide education support to anyone 3 and up who has a developmental delay, as is measured by their assessment. You go to the school district and you request the assessment. And from there, the assessment happens and then a treatment plan gets developed. For kids under 3, though, the school district doesn't support those kids. The program that does is called Early Childhood Intervention, and it's another federally mandated program that is designed specifically to assess developmental delays in small children. Because we know if we intervene early and we intervene correctly, we can bring those kids back up to where their peers are and set them up for success in kindergarten. And that's it. That's the goal. I want your kid to get to kindergarten and be able to excel in academia relative to their abilities and not be held back by something that's easily resolved when they're small. So when that referral gets made, you're going to get contacted by this agency, and they're going to want to meet with you. They're going to sit down with you. There's probably like 30 pages of paperwork involved. Sorry about that. It's just how it goes. They're going to ask you a bajillion questions about your kid, what your child can do, what your child can't do. And then they're going to sit down with your child and actually see what they can do and see how they do certain tasks. It's very developmentally appropriate. However, it is a little time consuming. My littlest just got assessed and it took like 2 hours. And this was a reassessment, so they already knew him. It is time consuming, but when you're done, you're going to walk out with 2 pieces of information you need. Number 1, the kind of delay your child has and the severity of it. And number 2, a plan to fix it. You will walk out with a plan. And that's the great part about developmental assessment, is that they're very, very goal-oriented. They want to teach your child to do this thing. When they learn that skill, they're going to teach them another skill. So you're always building on top of what the child's already learned. Severity of delay is actually usually expressed as a percentage. So my son's last evaluation, he was assessed as 25% delayed in one area. What that means is that he can do 75% of the tasks that other kids his age can do. He's got about 3/4 of what he needs. We need to cover that other quarter. which actually is an improvement, by the way. So we're making progress. Now we've reset goals for him and a time frame in which we want to complete those. Once he completes all of his goals, he gets discharged. And what that means is he no longer needs the service. So discharge is like the most awesome thing for anybody. So none of that's really complicated as far as I can tell. And I don't generally get questions about child development unless there's something in the system that's not working properly. So let me address a couple of concerns that I've heard, not so much from my patients, but from other people, like my friends who call me and complain. Let's talk about wait and see, because wait and see is something I hear a lot from parents, and I also hear it from other providers. Well, he's 1 and he doesn't have any words yet, but let's wait and see until 18 months and see how he does. Okay, you can do that. Wait and see is an option. However, it is a gamble, and I want to be really clear about that because I don't want you to walk in thinking that this is benign. If you wait and see and your kid catches up, that's awesome. But if they don't, what will have happened is that the gap between them and their peers is going to have gotten bigger and bigger and bigger and bigger over time. And it's more ground to cover, it's more skills to learn, it's going to take longer. So if I had put your child in therapy at age 1, it might have taken a year to get back on track. If we wait until age 2, it may take 2 years to get back on track, or 3 years to get back on track. And now we're almost in kindergarten, and we're still working with something that maybe could have been resolved earlier. So in general, I discourage wait and see. If it's what you want to do as a parent, it is well within your right to make that decision, and I will support you, but I want to be very clear that you are taking a risk. It is a gamble. You are gambling on the fact that your child is in the small minority of children who will completely correct by kindergarten. And so I'm going to put the referral in. You can choose to go or not to go, but I will at least initiate the services. If your doctor says wait and see and you agree, I think that's awesome. If your doctor says wait and see and you don't want to wait and see, okay, I'm not telling you to work around your doctor. Okay, I want you to work with me if I'm your doctor. I want you to work with your doctor, whoever it is. But if you're not getting what you need, there is a workaround that I should tell you about. And that is that the school system and early childhood intervention, these are government programs. They do not require physician referral for assessment, which means you can refer your child without me even knowing about it. That actually happens sometimes. I get stuff and I'm like, oh, I didn't know that kid even got referred. Come to think of it, I may have done that to my pediatrician too. So I should probably apologize to her later. Yes, you can go on either the ECI website or call the school district special education office and ask for an assessment. If you want to know where the ECI website is, it's actually elpasoeci.org, I think. Or look at the bottom of my Facebook page under the pages I've liked, and El Paso ECI is in there. Even if you're not from El Paso, you can click through those links and it will route you eventually to your local office. While it's federally mandated, it is run by a local office. Our folks in this area have 2 different offices depending on where you live. It's all by zip code. So you'll get services from that provider. They'll come assess your child without that referral, and then they'll request services directly to your doctor. As a doctor, it's really hard when I get a report from a speech therapist that says your child's 30% delayed. It would be very difficult for me not to write that referral for services. If that happens to you, I don't really have a good solution for you because we've identified a problem. I find it really hard to believe that a doctor wouldn't write you an order for it, for the treatment for it. So if that happens, we should talk about that. But otherwise, this system is really designed to support kids. There are other services out there that maybe aren't as mainstream. And if your child qualifies for them, we can kind of talk about that piece of things. If you have questions, if this didn't answer sort of your questions about how do I know, what do I think about when my child is doing things that maybe aren't quite on time, and how do I get that help, just comment on the video, or you can message me and we can talk about it. If it becomes where we're exchanging like a bunch of medical information, I'm going to ask you to come in and actually talk to me in person, because really shouldn't put our medical information out on Facebook. That's not a good call. Otherwise, thank you for watching. Again, sorry about the live streaming issues. I will be figuring that out later today. I hope you all have a good day, and I will be back next Friday for some other topic. If you've got any suggestions, feel free to message me. Thanks, guys.